Naresh, I know you have a pretty keen perspective on the impact that you see terminology services having for a health data utility like CyncHealth. So maybe just as laying the foundation in terms of how you approach this problem in your role. Can you talk about why that's such an important aspect to providing value back to your participants and those that are receiving your data?
Sure, Matt. Thanks a lot. CyncHealth, at high level, statewide health information exchange for the state of Nebraska and state of Iowa. The evolution of CyncHealth over the past 4 years, 4.5 years in my tenure here, we witnessed this move from a point-to-point exchange into mostly an analytics-driven, insights-driven exchange organization, which evolves into the concept of health data utility. So the foundation layer for this, in order for an entity to serve as an insightful data points generation, is to be able to produce meaningful, high quality data at the base layer, right? So that's when we started working with the foundation layers of data quality. There are event-driven profiling that you can look into. There are multiple ways you can approach the data. Data quality is always a subjective domain, right? So an administrative system that produces data points versus a clinical system that produces the data points at the same level of patient demographics can perceive it in different ways. So this added a lot of challenge for us because we get data feeds from multitude systems or multiple sources. When data starts flowing in disparate sources, such as clinical, electronic health records, pharmacy systems. In Nebraska, we have full prescriptions. So pharmacy systems is another example. Then we also get data from claims. We get data from social care systems. And there are several other augmentative sources of data that flows into our infrastructure. The challenge here is each and every source has its own specified standard of sort, right? Or the terminologies or the lexicals, how they follow. The ontologies needs to be efficiently managed at each source level. So for this reason, what we did is we were initially looking at ways by which we can approach the normalization in a meaningful way. Terminology server is by default the architectural component that we needed to provide as part of our normalization. And we were looking for specifically a modular solution, a solution that can actually be plugged into our infrastructure in a meaningful way that we can start querying across specifically for terminology needs and coming back into our infrastructure standardization pipelines together. So that's where we started with IMO initially. IMO was able to connect in both the ways. For batch processes, we were actually starting with SFTP-based bulk processing or batch processing loads. For transactional needs, we were able to get it at an API level. So that's the second layer. So these things lead to us first thinking about how we started initial IMO maturity with CyncHealth specifically. Each one of our state has its own infrastructure. So that's another reason why we needed to do a modular infrastructure, right? So we are single tenant on each state and the state-based infrastructure, jurisdictions and whatnot that clears the data governance challenges for us. So with those things in mind, so the initial origination of this concept of getting the terminology server that is really to the point of API driven and also flexible in a way that we can actually bring it into our day-to-day processing of transactions